What are the symptoms of a temporal lobe brain tumor? Imagine feeling like your brain is sending mixed signals or suddenly experiencing changes in how you hear, see, or remember things. That can be a sign of a tumor in the temporal lobe, which is a key part of your brain involved in processing sounds, memories, language, and emotions. One common symptom is seizures, especially complex partial seizures. These can cause altered awareness, strange sensations, or unusual perceptions. You might feel like you are in a dream or have unusual feelings that last for a few seconds or minutes. Seizures are often the first sign that something is affecting the brain tissue in this area. Memory problems are also frequent. You might notice trouble remembering recent events or learning new information. This happens because the temporal lobe plays a big role in storing and retrieving memories. As the tumor grows, it can interfere with these functions, making it harder to focus or recall details. Hearing difficulties can occur too. Some people report trouble processing sounds or hearing voices that aren't there. This is because the temporal lobe helps interpret what we hear, and a tumor can disrupt this process. Language issues are another concern. You might find it hard to understand spoken words or have trouble speaking clearly. This is especially true if the tumor affects the dominant hemisphere, which is usually the left side for right-handed people. Behavioral and emotional changes are common as well. You might notice mood swings, personality shifts, or difficulty recognizing emotions in others. These changes happen because the temporal lobe is involved in emotional regulation and social interactions. Visual problems can also appear. Some people experience visual field deficits, like losing sight in a quarter of their visual field, which is called quadrantinopia. This occurs if the tumor presses on parts of the brain responsible for vision. Sensory experiences such as strange smells or auditory hallucinations can also happen. These are caused by the tumor affecting the brain's sensory processing areas. The symptoms can vary depending on the tumor's size and exact location within the temporal lobe, and whether it's on the side of the brain that is dominant for language and speech or not. If these symptoms persist or worsen, it's important to see a healthcare professional for evaluation. Early diagnosis and treatment can make a significant difference. Remember, every person's experience is unique, so personalized medical advice is essential. Always consult with neurologists or other medical experts for proper assessment and care.